Graphites is one of the routine medicines prescribed in cases of duodenal ulcers. But unless the definite graphitis indications are present, one does not obtain a satisfactory result, and as there are quite a number of other drugs which also have a bearing on duodenal ulcers, it is important to have the graphitis picture quite clear. Majority of graphitis patients are rather overweight. They tend to be fat. They are actually pale in color, although sometimes they have a fair amount of color. One woman with a duodenal ulcer responded very well to graphitis, and she had quite a high color. Mentally, they tend to be rather despondent, depressed, and lacking in energy. It is not so much mental stamina they lack, but actual drive. They cannot make up their minds, are hesitant to all they do, and worry about their affairs. Quite frequently, you are told that the actual acute attack for which they concerned you was precipitated by a period of unusual mental stress. As a rule, these patients are chilly and feel the cold a good deal, but they are very sensitive to any stuffy atmosphere or lack of air. If you inquire into their history carefully, you often find that they have suffered at some time for some degree of skin disturbance, usually an eczematous type of eruption, very often eczematous patches at the back of the ears. Or they may have had digestive upsets with attacks of piles, very troublesome perianal fissures, and eczema. As regards their actual complaints, they have a beastly spoiled stomach with feel just out of order. They feel rather sick and get a good deal of irritation. That goes on to more acute attacks in which they have heartburn or actual acute pain, which is usually of gripping character. And when this is extreme, there may be attacks of vomiting. Not infrequently, these patients say that with the attacks of pain and feeling of sickness, there is horrible sudden sensation of extreme weakness, or feeling as if they were going to faint. Following this sensation of faintness, in quite a number of cases, there has been vomiting of blood or, short of that, definite malign for the next day or two. So this feeling of collapse is apparently associated with sudden gastric hemorrhage. In addition to the more or less chronic state, graphitis patients suffer from definite hunger pains which gradually develop about 2 hours after food and are relieved by eating. Considering actual likes and dislikes, one of the outstanding differentiating graphitis symptom is the marked aversion to sweets. There is very often an aversion to salt also, but this is not so marked. Frequently, one comes across a patient who has a definite aversion to animal food. This seems to be more mental than physical, for the patient will often say that the food tastes quite good if they can overcome the aversion, but they shy from taking animal food in any form. With their acute attacks of heartburn, there is feeling of intense heat in the stomach and throat and desire for cold drinks in order to cool down the stomach. But as a rule, graphitis patients are aggravated by cold food. When they have pain, they are relieved by warm drinks, very often especially relieved by warm milk. These patients always complain of a good deal of abdominal flatulence, a feeling of general abdominal distension with indefinite gripping pains. With these attacks of flatulence, they feel a sudden rush of blood, a sudden rush of heat to the face and head. With the general abdominal distension, they are very intolerant of any tight clothing. It makes them more uncomfortable, and I have been told that after one of the acute attacks, the patient developed a definite herpetic eruption round the abdomen. Most graphitis patients are constipated, and their constipation is rather suggestive. They have periods when there is no inclination for the bowel to act, followed by gripping colicky disturbance, and then an action of bowel in which they pass a very large stool accompanied by quantity of white mucus. Normally the stool tends to be palish, but after one of the acute attacks in which there is leakage from the gastric or duodenal ulcer. They have black malign stools. Often Graphites patients complain of very unpleasant taste in the mouth, either just a spoiled taste like the spoiled sensation they get in the stomach or a bitter salt taste. With this saltish bitter taste, they frequently develop little burning blisters on the side of the tongue. There is one other point that sometimes helps in diagnosis. Many of these Graphites patients develop a marked hyperesthesia of the sense of smell, particularly to the odor of flowers. This is not constant, however, and others suffer from chronic nasal catarrh, in which the sense of smell is entirely lost. They have a yellowish excoriating discharge, a tendency to develop cracks at the sides of the nose, and small, slightly spreading eczematous patches. As regards the actual pathological condition, most cases tend to develop a duodenal ulcer. In most of the satisfactory Graphites cases I have seen, actual ulceration has been demonstrated by a barium meal. There is astonishingly little scarring after Graphites. I have found that the ulcer has disappeared and the duodenal cap returned practically to normal as shown by the X-ray examination, and it is quite insensitive to pressure. In any case, with persistent scarring, I would give Graphites in low potency, say 6, for a week or two to see if it could be diminished.